right, good morning, everyone. I'm so happy to be with you all today. So today we're going to be presenting a presentation called Beyond the Transcript, Measuring What Physical Therapy Students Truly Learn. It's sort of a case study of assessment at Howard University. And to introduce myself, my name is Pavithra Suresh. I am Director of Assessment and Survey Research at Howard University. So I work in the Office of Institutional Research and Assessment under the Office of the Provost. And we'll also be featuring Dr. Sabrina Altema, who's a clinical assistant professor in the physical therapy program at Howard University as well. So to begin, I am going to talk a little bit more about assessment at Howard first before we talk about the physical therapy department at Howard. We're also going to have a panel discussion with Sabrina specifically, and then we'll open up for questions from the audience. But please feel free for any clarifying remarks or anything like that to raise your hand or put it in the chat if you have any questions. So to begin, assessment at Howard University, and bear with me, my cat Luna's decided to join us today. So assessment at Howard University. So at Howard University, we annually assess academic programs and administrative programs through the Howard Annual Assessment process. So all academic programs, including degrees, certificates, and orphan minors across all 14 schools and colleges, produce an assessment plan based on assessing student learning outcomes. And these annual reports serve the basis of the HAAP. So our HAAP process continues throughout the entire year. We aim to have, there's a bit of an overlap between one academic year ending for HAAP and the new one beginning to kind of facilitate a process of a continuous improvement. This is really a very robust process, including all kinds of measurement of student learning outcomes. And we also have administrative units complete these as well. So we also routinely assess general education outcomes through internal and external processes, including internal and external surveys, like our graduating student exit survey, our alumni survey. We have a student satisfaction survey. We also work with NESE and FESE, kind of, if you're in the world of assessment, you're familiar with these abbreviations, to assess general education through other methods. And we inform assessment at Howard University through our group IDEAS, which is Interdisciplinary Evaluation and Assessment Society, which is a representative body of faculty, staff, and students who give us feedback on assessment activities at the university. So this group meets quarterly with the intention of giving us some feedback on how we're doing, helping us kind of take the temperature of assessment activities on campus. And really, it's an opportunity for our community partners to kind of talk back to our office and help us understand what pieces we might be missing of the puzzle. So I do want to talk a little bit about the ethos of assessment at Howard, because I think we do things a little bit differently or with a different intention than I've seen at other institutions. And so we kind of have 6 pillars of assessment that we aim to highlight at assessment in our Office of Assessment at Howard. So the first is that we center students and equity. So all of our all of our assessment activities focus on the students and their experience. We encourage assessment to be used as a means to better serve students, enhance our institution, and improve institutional outcomes, growth, and success. So we also aim to honor community members' expertise. Every unit is responsible for leading their own assessment process, and we really give that work back to them because they are, they own their curriculum. They are the ones who are the experts in their own fields, and we help facilitate this process as consultants, as supporters, as opposed to it being sort of a top-down approach. To the extent that we can, we try and honor quality over compliance, allowing community members the autonomy to decide what is assessed and encouraging, greater buy-in and meaningful practice towards continuous improvement. Of course, we do have accreditation processes with middle states as well as individual accreditors for many of our programs. But to the extent that we can, we try and value quality over that compliance piece. We also foster a collaborative and personalized approach, offering one-on-one guided support, instrument consultation, programming ideas, and transformation insight for all units. And I really want to commend my colleague, who's I think on this call, Dr. Anil Lalwani. He really works one-on-one with every unit to get these assessment plans as robust as possible to ensure that what we're measuring really captures what faculty and staff aim to measure what they see on the ground to ensure that we are celebrating their successes as well as identifying areas for improvement. And we aim to demonstrate transparency and accountability by demystifying data and the assessment process as part of our intentional effort to increase transparency and trustworthiness. Data can be so opaque at times, especially when it's not contextualized or when it's not communicated effectively. And so we really aim to be leaders and model this practice of transparency in our office through reporting, by going out into sort of our university community and sharing this data as much as possible, and also getting feedback whenever we can through programs like Ideas. And then finally, we aim to cultivate lifelong learning. So this is a great example of the webinar we're doing today, for instance, where we offer several opportunities for continuous learning, including our assessment day. We have an assessment academy, which we invite faculty and staff to provide feedback on assessment plans and to also kind of learn the process of assessment. And we also have, Ideas, our assessment committee. We aim to really see assessment as a process that everyone can participate in, and that can facilitate a professional development opportunity regardless of what position you hold at the university. So kind of pausing there for a second, I want to now introduce the physical therapy program. So keeping in mind, we have 14 schools and colleges, hundreds of programs at the university. I think the physical therapy program is one that's really special. So it's housed in the College of Nursing and Allied Health Sciences. And the physical therapy program offers an accredited program leading to a Doctor of Physical Therapy degree. Students in this program are exposed to cutting edge research and practice in both the classroom and the clinic. And so there are these kind of different classroom environments that students get to experience. And in the 2-year average for graduates in 2023 to 2024, the licensure passage rate was about 94%, which is phenomenal. We're really happy to see that. I do want to note that the program is accredited by CAPD, the Commission on Accreditation in Physical Therapy Education, as well. So some of the unique features of the PT program at Howard, because I think every Howard program does bring something a little bit different than you might see it at another type of institution. There is a focus on training a cohort of predominantly African-American PTs. So with Howard being an HBCU, our student population is predominantly Black. And so understanding that and understanding as well how the medical sciences are often underrepresented, or Black people are underrepresented in the medical sciences, it's essential, very important, I think, and essential that we're training a cohort of people who are underrepresented in that field. In addition to training an underrepresented population to be these practitioners, the physical therapy program also serves under-resourced community members local to Howard University in Northwest DC. So if you're familiar with the DC area, Howard University is housed in LaDroit Park, which is a historically Black and lower wealth community. And Howard is an open campus. So even though we are this illustrious, high achieving campus in DC, it's also open for our community members to come to events, to come to clinicals, to use different medical services, that kind of thing. So there is this ethos of service that's integral to the Howard experience. And there is a cadre of faculty who train students in cultural sensitivity and community service, in addition to self-inquiry, active learning, and ethical behavior. So there are these components and these values that are embedded in the PT program that I think make it really special and provide an environment to train an underrepresented population to serve an underrepresented population. And I think that's something worth noting as well. So next, I want to introduce Sabrina Altema. So to give a little bit of her background, Dr. Altema is a clinical assistant professor and director of the clinical education at Howard University's Department of Physical Therapy. She's an orthopedic certified specialist with over 15 years of clinical and managerial experience. And she has a number of different professional and community organizational roles as well. And she's also pursuing her Doctor of Education degree in Curriculum and Instruction with scholarly interest in evidence-based instructional methods and strategies for improving the experience of underrepresented minority students within physical therapy education. So she's really the perfect person to speak with us today. And I do want to hand this to Dr. Altema to ask her to tell us a little bit about herself. I know I kind of gave her bio, but tell us about the activity she's doing on campus right now. And then we'll move into the next section of the presentation.
All right. Well, thanks for having me. I'm excited to be here and kind of talk and showcase our program because we're extremely proud of the accomplishments that we've had over the last couple of years. As Pavithra said, I'm a clinical assistant professor, and another role that I have here is director of clinical education. So when we think about students coming in and getting them through the curriculum, our end goal is to get them to be effective and efficient clinicians. And our authentic experiences are a big part of that. And so I kind of manage that. Again, my background is in orthopedics. So in some of the things that I'll talk about later, I'll reference anatomy, kinesiology, all those great classes that we love teaching here. And again, I am pursuing my EDD in curriculum and instruction. So I really love nerding out on things that we do in the classroom and, just as you had mentioned, assessment.
Thank you. So we're going to move into this panel discussion, which will probably be the majority of this presentation. So we have a few different sections that we're going to talk about, which is classroom-based assessment, outside of the classroom assessment, and program level strategies. And then we'll also invite questions from the audience. So if there's any other things that are kind of, that you're burning questions that folks have, we can discuss those as well. Although please feel free to, raise your hand or put a comment in the chat if you'd like to. So before we even move into that, I'm wondering, Sabrina, if you could tell us a little bit about how the PT program is structured curricularly. So what do students do when they enter the program, and what does that look like kind of on the ground?
All right, that's a good question. So when our physical therapy students begin, we start in the fall semester, and the way the curriculum is designed is to begin with our foundational courses through the first year. Then we integrate clinical or authentic experiences in between. So after the first year foundational courses, the students have an opportunity to learn in authentic settings for the first summer. And then they come back for our next layer of courses, which are advanced courses. And they start to implement a lot more of the things that they got to experience over the summer. And then they go and have another authentic experience for summer 2. And then they come back to, again, do additional application type of coursework. And then in the spring semester, they'll end with the final clinical experience to kind of tie everything together. Once they complete the curriculum, all of our students must sit for the national exam. And so that's also a big part of how we kind of build our students to success by the time to get to that final assessment.
Excellent. And one of the things that we think a lot about in our office is when we're establishing student learning outcomes, we're thinking about what is like a graduate of this program able to do, right? What if we imagine like the best student we've had, if we imagine the student who really embodies all of the values and the mission of the program, what do they do? How do they carry themselves? What are they able to do on the ground? How do they present? So Sabrina, let me ask you, what would that student look like from the PT department?
Well, that's a good question. Again, coming from as a historically HBCU, Historically Black College University, we really, really value students that share that ethos of community service. And so we really value community service and impact. We really value the idea of our students feeling confident in the material that they've learned and then able to kind of go out into the world and make informed clinical decisions as they care for their local community. And so that's one of the wonderful things that I appreciate about our university. A lot of our students are from all over the country. And so they come to Howard, they have this experience with us, and then they kind of embrace the culture that we've been able to kind of work with them through and take it back to the local community. And so again, our real essential pillars for those students that I imagine leaving here have that competence, they have that confidence and self-efficacy, and then they have that desire to kind of work and help the communities in need.
Excellent. So moving to thinking about classroom-based assessment, how does the program design assessments to reflect those real-world clinical decision-making moments?
So it kind of reflects what I just mentioned. So when we approach classroom assessments, we always approach them with the end goal in mind. And that's, again, to develop thoughtful and caring practitioners who have the competence and self-efficacy to care for our communities in need. And so what I mean by that is, like, I teach a foundational course in clinical kinesiology, and that course aims to do a deep dive in anatomical concepts and eventually have students complete like functional movement assessments. However, an additional course goal is to also lay the foundation for transferable clinical reasoning and decision-making skills that they will need for subsequent courses. So the assessments are not just recall questions about anatomy and kinesiology. We actually begin to ask the student to think conceptually about how the course material relates to the bigger picture as a clinician, and then how that foundational information supports future development as a physical therapist.
So you kind of touched on this. This is great, which is, what role do those practical exams play in evaluating those student competencies?
Yeah, and so the practical exams play a big role. And so with the practical exams, they're foundational for these authentic clinical experiences that we mentioned above, or that I mentioned above. And so we monitor progress with like no stakes proficiency assessments. We provide students with an opportunity to understand these expectations. They give them a chance to kind of look at the rubric and practice the necessary skills in order to prepare for our practical exams. But more importantly, the practical exams are scaffolded. So we eventually have these no stakes opportunities translate to high stakes assessments that involve independent evaluation, clinical reasoning, and decision making from the student. And that's all to make sure they're ready for that clinical experience.
That makes a lot of sense. I think you mentioned as well, you're trying to move away from that like rote memorization. So how do you ensure that those written assignments or quizzes kind of go beyond that and move towards like conceptualization? How do you approach building those kinds of assessments?
So it's can be a combination of everything that I had mentioned. And so we absolutely use Bloom's taxonomy, and we use it throughout the courses and through the curriculum, but we don't keep it a secret. And so as a part of our extended orientation, we actually discuss learning and study skills, and we explain Bloom's taxonomy to the students, and we ask them to reflect on how each level of Bloom's taxonomy evolves throughout the curriculum. And so when doing this, it kind of gives the students a better idea of the role of rote memorization and how this gradually develops into deeper learning as they move through the curriculum. So for example, like we all begin with anatomy, and a lot of health science classes begin with anatomy. And so that automatically requires a lot of rote memorization. So we don't ignore it, it's there. We need rote memorization to grasp those foundational pieces of information. But then we use that information for the next course, kines, which is where I come in. And so there we apply it to more challenging tasks like movement analysis, and then eventually progress to advanced courses and the clinical experiences like I'd mentioned before. And then this is where we kind of draw ourselves towards the top of that Bloom's taxonomy, because at this point, the student needs to evaluate and create their plans independently. And so again, we begin with that framework with Bloom's taxonomy, starting at the base level, but then we share that experience with the students. And with the students, they also understand that we need to get to a deeper form of learning towards the end of the curriculum.
No, that makes perfect sense. And especially thinking about how the curriculum is scaffolded so that students do have these out of the classroom experiences. I think that makes a lot of sense. So I want to ask a little bit about those outside of the classroom experiences, understanding that there are these different moments throughout their curriculum experience that they are in the classroom, and then some that they're doing kind of more clinical work. So can you give us some examples of what that clinical work can look like?
Yeah. And so for our program, we are, as you mentioned before, we have accreditation through Middle States, and then we also have our own separate accreditation, which is through the APTA, or American Physical Therapy Association, and CAPTE, actually, the commission. And through them, we also have standards. And with those standards, the students must engage in diverse learning experiences or diverse authentic experiences. And so we have to manage where the student is and the type of setting that they go to. So it could be in a hospital setting, outpatient setting, or something a little bit more complex like a rehab center. And so that's the framework of our clinical experiences that we embed throughout the curriculum so that the students get exposure to didactic material and clinic interspersely throughout their time. But an ongoing theme for us is, again, beginning with the end goal in mind. And so because of that, we scaffold each clinical experience to develop the skills necessary for effective clinical practice, which is what we want the students to have at the end of their experience. And we'll do that through formative and summative learning assessments for all the rotations. So when we're just talking about our clinical experiences, some of the formative assessments that we have are specific learner tasks that reflect the classroom material across all the domains. And so those learner tasks will change as each clinical experience because the student's gaining more knowledge. We also, the students are guided with like weekly feedback forms that facilitate that preparation, the clinical reasoning we want to have at that level, and reflection. And then we work very closely with the preceptor to provide that feedback on performance and goal setting. And so that weekly documentation really allows students to reflect on and monitor their progress, as well as assess their confidence levels as they evolve through each of these experiences. And so we want the students to think critically about their performance and how those moments kind of shape their trajectory towards our end goal of being an effective PT. And so those are the formative assessments, but like summative, we definitely have course projects, and those course projects really incorporate the program pillars. And those include like interprofessional collaboration, inclusive and ethical practices, and then evidence-based research. Okay, and so those are the things that we do just as a course. But again, for consistency, we also have a standardized evaluation tool, and that ensures that the students are actually being graded fairly throughout each of their clinical experiences.
That's fantastic. So that was actually the question I was going to ask, what mechanisms are in place to ensure that consistency across those different clinical sites? Are there any other kind of mechanisms for standardizing that assessment?
Yeah. And so with our program, we have minimum requirements, and those minimum requirements usually come when the students are going to be working with preceptors. And so in addition to, of course, kind of making sure these spaces are inclusive and really lean on that sense of belonging for optimal learning experiences, we also have minimum requirements where the preceptors have to be trained on how to use the tool correctly. And then we incorporate the weekly feedback forms and site visits to make sure that all perspectives of that experience are accounted for, and to make sure the student is progressing towards that end goal of effective and efficient clinician or practitioner. And so we've had like, and so this is like a really important, since we have varying settings for our clinical experiences. And so like in an acute care setting, those settings tend to be a bit more complicated and complex because the patients are medically complex. And so we always have some coaching involved to make sure that the student is assessed at the appropriate level. And so again, to ensure consistency, we have a standardized tool that we use for all clinical experiences, and then a lot of ongoing dialogue between the student, myself as the director of clinical education, and the preceptor to make sure we're all on the same page and evaluating the student effectively so that we can get to that end goal that I'd mentioned before.
Fantastic. Are you able to give us an example of what that looked like, maybe in the clinical space?
Example of what looks like?
Of a student maybe engaging in this, in these, in the clinical example, like a more complicated case, let's say.
Oh, yeah.
How you've guided them through that.
Yeah, and so again, since they work very closely with the preceptor, I always get this information from the weekly feedback forms, which I find fascinating. So like the students will reflect on those complex experiences. And so I remember over the summer there was a patient that was aphakic, and so that just means that they had a difficult time communicating. And that tends to be one of the challenges when you get to the hospital setting, like communication with the patient can be challenging, where there could be a different language, where there could be a traumatic brain injury, where there could be any of these other factors. but the underlying goal for the student is to help provide care. And so monitoring how the students approach this situation and how the preceptors help facilitate growth and how to process that complex situation is what we really appreciate with the feedback forms and from the experiences that the students have over the summer. And so again, when they're in school, it's like, they're working with their, able-bodied partner, but then once you get into these other settings, things change. And with the tools that we have, the evaluation tools and the feedback forms, we can literally see how the student processes that exact moment. And then we can later on reflect on it as they see the weeks go by and their comfort level change and improve as they work with these complex situations.
That's excellent. So how do you tend to incorporate that feedback both from like the student about their experience, their reflection, as well as, the clinical instructor or the preceptor into a student's overall competency profile?
So I meet with all the preceptors during their clinical affiliations, and that way I can actually talk to them and get their feedback on student performance and their expectations. And so if like a preceptor feels that a student isn't meeting expectations, then we always work together to create a success plan tailored to the student's needs. And we monitor that closely. And then again, if the student doesn't make adequate process, then we'll meet as a faculty and we'll discuss further remediation plans. But of course, like if the preceptor thinks the student is a rock star, which can always happen and does, then we also collaborate on how to like maintain motivation and then safely challenge the student in those spaces as well. So it's really the ongoing communication versus both like in-person or virtual meetings and written feedback on a consistent basis that allows me to really see the student's overall competency program profile through that experience and through all subsequent experiences.
Wow. So it sounds like you're really tailoring this to each individual student who is in their performance, which I think is incredible. That's what an educational experience these students are getting.
Yeah.
So thinking a little bit about those program level strategies then, what tools or frameworks does the department use to track student progress over time? Like how do we, how do you think about that both for the individual student, but also the larger cohorts?
Yeah, so we have a pretty solid plan. So we have weekly faculty meetings, which are great. And we discuss like student progress, and we absolutely spend time talking about students that may be at risk. And so student at risk, they always meet with the developmental team. And so that includes the advisor, that includes myself, it includes our educational specialist. And we establish a student success plan collectively. And so we continue to monitor their progress through the semester and the curriculum as needed after implementing these plans. But another way that we track student progress over time is that the students do take comprehensive summative exams at the end of each semester. And then we use that information to provide support structures for subsequent courses, or if it's in the case of like the completed curriculum, like they graduated, then we absolutely use that information to help them prepare for our national examinations. And so from beginning to end, we always have some form of assessment for the students where we gauge where they are, how they're doing, whether they need additional support. And if they need additional support, we have a plan in place to make sure they get that support. And then we reassess across all classes and at the end of the semester. And so at no point are we confused about where students are, because we do a good job of having that conversation and making sure we catch them as early as possible and providing them with the support structures needed to be successful.
So it sounds like there are quite a few summative assessments as well, like comprehensive exams, for instance. How do you typically balance those formative assessments versus the summative assessments throughout the curriculum? Like how do you strike that balance as to what needs to be on a summative assessment versus a formative one?
I love like no and low stakes formative assessments. And so they're all over individual courses, mostly individual courses, because we do need those high stakes exams at the end to really gauge where the students are. But I use a lot of no and low stakes formative assessments throughout all my classes. And it's usually in the form of like think, pair, share or metacognition sheets, a lot of compare and contrast, a lot of concept maps or check for understanding. And in the beginning, the students kind of find it as like a little bit of a nuisance because it's like extra work that isn't graded. But after that first semester of implementing it, the students really latch on because it provides the feedback that they need in preparation for those high stakes exams. And so most often they're asking for it. They want me to post the questions in Canvas, things along those lines, because that no stakes really gives them a good, honest idea of where they are and gives them more time to prepare for, again, our high stakes exams. And as I mentioned earlier, we do use summative written and practical assessments at the end of the semesters to make sure the students are safe because we're going into the clinic, and to also identify students who need additional support.
Can you tell me a little bit about what those practical assessments look like?
Yeah, so the practical assessments, those, so for, I'm in a class right now, and so we have a midterm practical assessment, and then we have a final practical assessment. And that midterm practical assessment, that's basically our scaffold. So that's basically like competency based. And so we're essentially giving you a very low level case, and we just want you to demonstrate the skill set. And so that's at the midterm. By the final, we continue our lab work to make sure that the student progresses to the space where they can start to do clinical decision making and clinical reasoning independently. So that final practical exam is essentially an evaluation where the student's asking questions, gathering information, synthesizing that information, and then producing their own assessment. Mm-hmm. And so with that, we're able to get an idea of how that clinical decision making actually progressed from the beginning of the semester towards the end of the semester, and we guide them in that direction.
That makes perfect sense. So can you share also how the program might have adapted assessment depending on evolving standards in physical therapy education, evolving standards with accreditation, maybe different kind of current topics in the field?
Yeah, so we actually just had our standard change. And it wasn't the standards, when they establish them, they don't usually do like drastic changes, but we actually did have one in 2024. And so our primary goal is to maintain alignment with the evolving standards that are set by the governing body, the standards and the mission statements set by the university, and of course, the one that we establish as a program. So the main goal is to maintain alignment no matter what it is and how often it changes. And so as a team, we do that yearly with our retreats, and we focus on those updated standards, how those affect curriculum assessment, how we maybe implement research opportunities, and then of course, stakeholder feedback. But the easiest way to kind of manage the evolving standards is with like curricular mapping. And so it makes it easy because we have both views. We have that big picture view, which I love starting with. And then we also have that like worms view, I guess is what they call it. But when we have these evolving standards, it's so much easier to implement those changes when we have a good idea of where we are within the curriculum.
That makes a lot of sense. So I'm wondering too, we talked a little bit about how when we're setting student learning outcomes, we're thinking about a student that really embodies the values and mission of the program. Can you give us an example of one or two students, you don't have to name names, of course,
Yeah.
that you've recently worked with that you feel like really were able to capture those, like we're able to achieve those outcomes successfully?
Yeah, and I mean, again, it's only been the first year, and there's a student in particular that embodies exactly what I'm talking about. And so often when we think about assessment, we think about the cognitive aspect of assessment and how well the student can either relay that information in the classroom, but there's also the psychomotor aspect of it. So the comfort level with hands-on skills, and what's most important to me, the affective component of it. So how they engage with the patient, how they engage with the colleagues, the interprofessional team. And so when I think about a complete student that graduated from Howard's program, I think about all of those evenly matched. And we definitely had a student over the summer that just like kind of crushed it on all accounts. And as a first year was actually asked like, do you want to come back and work here when you're done? And so when I hear feedback like that from the preceptor, that's how I know that the plan and the structure that we have in place so far is effective to where the student is able to comprehend the tasks that are required of him or them, and they're able to engage which can be difficult coming out of the experiences that we had 5 years ago. So being able to engage with the colleagues and the patients, and then again, being able and comfortable to kind of implement those hands-on skills needed for patient care. So all those components, in addition to like just being an awesome person and physical therapist, potential physical therapist, that's what I think about. And we did see that over the summer. So all domains.
That's incredible to hear. And I'm wondering too, you know, I obviously we work together a lot through your work in assessment. I'm wondering how different university level assessment processes help facilitate any of this work. How do you use the HAAP process? How do you use other types of assessment processes that are occurring, whether it's surveys or, focus groups, whichever kinds of methodologies most resonate with the work you're doing. How do those kind of support or bolster the work you're doing?
So the great thing about the HAP program is that it parallels. And so the reason that's very helpful for us is because the items that we're asked to complete also parallel the things that we are asked for by our accredited body CAPD. And so what really helps us is that but the accreditation process for CAPD is typically every 10 years. And so when we have these checkpoints every year to kind of take a look and reassess where we are using HAP, it allows us again to highlight those important factors that we already need, the important data points that we already need to gather. And then it allows us to collect that information in incremental fashion so that when we do have our big assessment, we can really pull on the information we already submitted to help contribute to our larger accreditation submission. And so, working with the assessment team, implementing surveys, pre and post surveys for all of our community service events, and we definitely do a lot of them, pre and post surveys for our clinical experiences, a lot of stakeholder feedback, not just from the students, but the preceptors, from our community partners. So implementing all those surveys and guidance on collecting all of those artifacts to put them in our yearly assessment really allows us to, again, gather that information, look at it on a micro level, and then be prepared when we do have our big accreditation to submit all of that information.
Excellent. So I'm wondering too, before we move to questions from the audience, what advice might you give to someone who is in a similar role to you, maybe either as a faculty or directing clinical education, when it comes to starting this work to assess student learning outcomes?
The first thing for me is like buy-in. And so you got to get buy-in when you really understand the process. And so coming in, I was coming in as a clinician. And so understanding the academic version of assessment took a little bit of time. And so, but once I did understand it, it clicked immediately. And the buy-in was understanding the relevance of the information from the data we gathered. And so every piece of data that we gather is an opportunity to improve the program and an opportunity to provide more for our students. And that's basically why I'm here. Because I want, again, end game is that competent, confidence clinician that goes back to their community to provide services to those in need. And the way I can do that is by gathering information from every stakeholder, synthesizing it, and finding ways to continually improve. So like the biggest thing for me is get that buy-in from whoever you're working with, whether it's the faculty and or faculty members, like preceptors, students, get that buy-in to really gain an appreciation for feedback. And it's once everyone's comfortable giving feedback and receiving feedback, I mean, it's just like a well-oiled machine. It's just like everyone's ready to provide suggestions because everyone's end goal is the same.
That's excellent. So I do want to kind of move to the chat to see if there's been any comments or questions. Let's see. So someone did ask what the Assessment Academy was, which I kind of can go back. The Howard University assessment process involves a summer intensive where we invite faculty to help us review assessment plans, and they can give feedback to colleagues on those assessment plans based on a rubric that we've created of what makes a robust assessment plan. And so what's great about it is it not only gives us the opportunity to have multiple eyes on different plans, providing that feedback. It's not just myself and my colleague Anil, but it's also other people around campus. But it also offers a professional development opportunity for those faculty and staff to then kind of get into the weeds of assessment a little bit more. And the feedback we've gotten has been that that's been a positive experience where it's generative. It helps them to sort of see assessment from a different perspective, learn from their colleagues' work. And there's something about providing feedback that helps you to kind of improve your own work as well. So that's what we've found to be true. And then I see Dr. Searles has provided that feedback. So Dr. Searles is also asking if you use simulations before clinical experience.
That's a good question. We do use simulations. And so the simulations are a bit, so the simulations are basically where the student will go to our sim lab and they'll be able to work with mock patients to, again, kind of work through a case. And you can make the case as complex or as minimal as possible, which is really, really nice. And so we tend to use that as an exit practical exam. And so again, we use the semester to kind of scaffold the student into the clinical decision skills needed to be able to be successful when they are working with a mock patient. And so success with that mock patient in the sim lab is, again, our checkpoint for safety and competence before they actually go into the clinic.
And Bina is asking, do you use any assessment management systems, so technical tools, for instance, to document classroom or out of class assessment?
Like Excel is like my best friend. And so I tend to use Excel spreadsheets. We do have an official tool for the clinical experiences. And so that tool is extremely helpful and it's built out by our, again, governing board. So it's very involved. And that allows me to have the preceptor interface, the student interface, and then my interface. And then at the end of the assessment, midterm or final, we can pull down the Excel spreadsheet, which is basically what I have. And then that gives me all the information I need for the graded tool. But it's the same situation for me. So once I have that information, I do synthesize and find the themes within that assessment.
Perfect. And then our university is also a watermark university. So we use the watermark suite for those higher level assessments. So thinking about the HAAP process that's facilitated through watermark planning and self-study. Manish is asking, do you have a dispositions assessment as part of the SLO process for your program?
Can you clarify?
So Manish, if you're still on the call, if you don't mind expanding on that question. So I'm thinking this might be in response to thinking about that affective component. Okay, so for instance, how do you capture the outstanding students? Your example of the exemplary student.
Okay, so I think you're breaking up a little bit. So let me see. I'm going to pull up the chat. Sorry. For example, how do you capture outstanding students in your example? Oh, got it. And so, yeah, so we're able to do that because of the evaluation tool that we have. And so the evaluation tool, which is the clinical performance instrument, has a scale on there. And within that, the preceptor can, again, provide narratives, and so can the student. And so if they reach a certain number, then I can tell that the student's actually doing well or exemplary. And so in that situation, I talk to the preceptor, and then we kind of strategize to make sure that we're able to maintain motivation and challenge the student to continue to progress. Is it in the tool itself? So there isn't a marker in the tool that says we have a high achiever. It's just the tool gathers all the information, and then from the synthesis and the conversation I have with the preceptor, it lets me know like, okay, hey, we have a high achieving student. Here are some of the strategies that we want to implement for that student, and vice versa for those that are not achieving as well.
And so thinking about, I think Dr. Searles is asking about that affective component that you mentioned as well. What does that look like in practice?
And so for me, it's like I have this pin right now, actually, and it says tell your story. And the reason I have that is because it's all about like, I want the students to tell their story and think about their brand when they're in these spaces. And so I try and shy away from terms like professionalism because I don't want all those other connotations to kind of come into it. But it's like, hey, you know, with the student, how do you present yourself in the clinic and how do you want to be perceived in the clinic and represented? And so when I think about those affective components, I think about someone that's engaging, that's able to have, you know, clear communication. That's a big part for me. So being able to communicate in challenging situations or situations that are like going great. And so all of those aspects, you know, timeliness, all the things that we think about that we want from a healthcare practitioner, that's the active affective part. And when we do those learner tasks, that's included, particularly communication, and that's written communication, nonverbal communication, verbal communication.
So one thing that's making me think of a little bit is that hidden curriculum, right? So we know that when students are coming from backgrounds where they maybe have been less exposed to a specific clinical environment or classroom environment, there is a learning curve. How do you navigate that as both an instructor and clinical director of kind of making that more transparent, making that hidden curriculum come to light?
Sorry, can you repeat that? I was reading the chat. I'm so
Oh,
sorry.
no, you're totally fine. I was saying
Yeah.
there's this idea of the hidden curriculum,
Yeah.
the things that students that some students know because they're more familiar with an environment, and other
Yeah.
students it's opaque to them because they're not less familiar.
Yeah.
Knowing that there are underrepresented students that are, you know, being served by this program, what are some of your strategies for bringing that hidden curriculum to light about, you know, the affective communication piece specifically?
And so I always frame it in the terms of what their end goal is, right? And so what you want to do is you want to be an effective physical therapist. And one of the ways to do that is you have to have these components of communication. And so that's really where I centered around. And so when I do have a student that may not meet the expectations for that affective component, it's all about coaching. And it's a simple conversation, not simple conversation, but it's a little bit easier because the students find more comfort, or from my experience, find comfort in having conversations with those with similar lived experiences. And so when I sit down with them, I can relate like, hey, you know, I'm first generation. My parents did things a lot differently at home than I did when I was out. And so sharing some of my personal experiences and how I've learned from others to kind of maintain the type of branding that I want for myself is the same thing that I share with my students. And so when I find a student that isn't meeting those affective components that we feel are necessary to be an effective clinician, I just remind them like, hey, this is our goal to get you to this point, and here are some of the things that'll help you get there in terms of communication with other people, with other patients, et cetera, et cetera. And so the reason I keep bringing up communication, that's usually what it is. It's usually like written communication is like dodgy. We get a lot of like crazy emails. And so we definitely kind of coach the students up on how to improve that level of communication.
That's excellent. Thank you. And I want to see if there's any other questions from the room. Yes, go ahead.
Well, thank you for that wonderful conversation. Sabrina, how do you track students' progression of
And so
learning?
we use again, it's like across all domains. And so when you think of the cognitive, then we have our there are graded information. So as a team, we are always talking weekly on students that are not meeting cognitive expectations. So if they're struggling in a class, we know what the grades are in the class and we track them. For me, like I said, I use Excel spreadsheets and I usually have all the grades because I'm in charge of clinic. And so I have that aspect of it. When it comes to the skills, because we also have psychomotor skills, then we use the practicals and we gather information from the practicals, and then we see same student, how are they performing? Is there one that's stronger than in cognitive than in psychomotor? And we kind of make those adjustments. And then again, how they are communicating within the classroom. And so we combine all of those to see how the student's doing. If the student isn't meeting expectations, then we have clear conversations with them and we track that with a formal, like, again, enrollment into the student development team. And so,
Thank you. And are those assessments, are they done at the student level or at the course level?
They're done at the course level.
So not not at the student level, individually, where you can track the progression of each student.
Okay, so I want to clarify. And so for each course, we're tracking the students within that class. So for example, I have an anatomy class right now. I know exactly how many students need additional support. And so I'm tracking those students that need additional support in the anatomy class. And we do the same thing for the other classes within our fall semester.
Okay, thank you.
Sabrina, if you don't mind, I do have a question. You made you referred to the set of skills, competencies, SLOs at the course program and institutional level, how they shape the student, right? As to if I think the phrase that you used was, if I were to envision an ideal student, right, perfect student, what I would expect that person to be able to do at the end of each one of these. And I think that's a very vivid, very telling description of what SLOs are all about. I think that's very, very empowering to faculty, because when you think about it, for the most part, we've been addressing the questions of SLOs and program learning outcomes from this bureaucratic, let's say, accrediting guideline perspective. And all of a sudden, you are asking each one of us, okay, as a result of this work, what is it that you want our students, or we want our students to be like? What do you want them, what do we want them to do? I think it's just a fantastic sort of like switch of a perspective. I really, really, really appreciate this. That's really cool. And I really like the part when you mentioned Bloom's taxonomy, how seamlessly all those verbs, as to student performance, that describe student performance, uh, come into play, and all of a sudden they are vivid. They become the reality. This is what you need to do. So it's not anything murky there. There isn't any just engagement. Hey, engagement means, look, Sabrina is smiling. She is definitely engaged, right?
Yeah.
But the point is what it is that students, what are the skills and competencies that students are getting out of that activity.
Yes.
So I certainly appreciate this. And then if you could please elaborate just a little bit more about the concept of the self-assessment, because I really like how you describe this, that there is a instructional process, students are engaged, and at the end they produce something that will help them assess themselves. I think, that's one of the best pedagogical practices out there, right? When you create an instructional material and you can teach somebody else.
Yes.
If you could please elaborate on this a little bit, on this process of self-assessment.
So I love reflection. And so it's going to be, and we're going to incorporate this in a couple different ways. So from the clinical standpoint, because I'm the director, that's kind of where a lot of my purview is. That weekly assessment incorporates both aspects and incorporates what the student actually has to do, the learner task expected of them, and then the reflection aspect. And so what I want the students to do is I really want them to think through their week and how they performed with all of the patients, and then again be able to recognize the gaps in their learning. So they're using that to recognize gaps in their learning, and so that the following week we're going to make sure that we address those gaps, whether it is work at home, going back to the textbook, whatever it is. So again, we can build on that week to week. And so that self-reflection aspect is really giving the student their own assessment and then allowing them to take an active step in filling in those gaps. In the classroom, I love including those no-stakes self-assessment tools so that the students are aware of those gaps very early before they have to take the exam. And so initially, it seems like extra work, but when I'm walking around and I'm looking at them completed, I see a lot of blanks on that page. And so you see a lot of blanks on that page. And now you understand that you don't quite have the material yet. And so that student's able to self-assess and then use self-directed skills to kind of fill in those gaps or take initiative to ask for more assistance for clarification. Does that make sense?
Absolutely, yes, definitely. And you're absolutely right. See, right from the beginning of the course, if we stick to what it is that we expect students to do, they will live up to that expectation.
Yeah.
I think that there is, again, a lot of us with best of intentions, we by design are very murky about our expectations. That it's something that, oh yeah, just read chapter 7, next Thursday we'll give you a test. And then, a student comes back saying, well, yeah, but really this was not chapter 7 only. Well, yeah, you should have known those things from previous courses or something like that, right? All of a sudden just becomes the content of the course, the skill, the competency that students are supposed to be developing become very, very diluted in this expectations sort of like that grow in the spirit of the moment, again with best of intentions, because again as human beings we are all different, we communicate differently, we understand things differently. So I think that your message of sticking consistently to what it is that students need to learn is just very, very, very strong, very powerful voice. So I really, really, really appreciate this is just fantastic presentation. So that's that, and I just wanted to commend you again on the presentation itself. I really like the question answer format. It was just because you know how it is. It's just kind of like you have one person speaking all the time. It's just kind of okay. Well, I do take notes, but it's just at the end of it, it's like whoa, did I miss something? So the question and answer was just very, very very well articulated. And then if you could please, you mentioned that you're at the Watermark University. Uh, if you were to name, I don't know, 2, 3 features of the program, sort of like if you were to like show and tell what it is that Watermark does for you, that you're really, really, really happy to use them, to have them.
Sure. So I think that the platform that I think works like very well is planning and self-study. It has really allowed us to streamline the process of assessment, particularly because we do an annual assessment process. So I think that's a little bit different. Having 180 something programs and offices do an assessment plan every year is just administratively quite a task. And so having this kind of template built in that's customizable and streamlined and allows each unit to then extract like a report that's a PDF, which streamlines their own accreditation processes very seamlessly. That's something that I think is just excellent. I've heard kind of horror stories about what was happening prior to us starting using Watermark, of just like documents that were locked and like handwritten sticky notes, that kind of thing. I think that it just that logistical component of organizing assessment data is just, it can be just such an undertaking. So that's the feature that I think is really great. We also use course evaluations and surveys, and faculty success, which do kind of talk to each other, which is nice. I think faculty success, while there have been some hiccups, they have improved that process a lot. And so I think that is really, for the faculty, especially for adjunct faculty, when they're trying to organize their portfolio of all of their evaluations, it's pretty streamlined. And so I think that's very nice as well. And then the thing that I'll really celebrate about Watermark is that their customer support is great. The number of calls I get on with Watermark all the time, they're really responsive. And so that's where, that's not always the case with vendors. So I do appreciate that, their responsiveness more than anything else.
Sounds good. Sounds good. As long as you're happy. And then the assessment of student learning outcomes, again, the SLO, so direct assessment or results of assessment at the course level. How do you handle it in Watermark, if at all? Do you actually get the information about student learning, and do you create reports as a result of this? Do they inform accreditation processes in other ways?
So I think that that's something on like a larger scale we're aiming to do. But because each unit kind of owns their own assessment, this is happening more in like a more of a micro level. So we are trying to look at doing like a larger gen ed assessment using some of the, there's some back end tools within the planning and self-study that you can kind of map different competencies onto different outcomes that you're measuring, which is, it's nice. It kind of builds this little crosswalk that you can then export and kind of put together as like a dashboard, just to really visually see like what's working, what's not working. to be clear, though, we haven't really used that as much as we could be. But it is one of our goals kind of moving forward. But I will say, I think on the program level, I'm seeing folks use this technology as well as like their own assessment tools to do that assessment. But when we're thinking about the institutional level, that hasn't quite been where we haven't quite gotten there yet. It is a goal, though.
Right. Sounds good. Well, thank you again for the presentation. It's been very, very insightful. It is 11 o'clock on my clock here, so I'm going to stop the recording.